If lasers are so amazing at helping the body heal, where's the research that lasers help tissues heal 25 to 35% faster from surgery or injury, that they reduce chronic neck and back pain, improve immune responses, peripheral neuropathy, tennis elbow, and concussion recovery? That's what I asked. And while I'm at it, how come my doctor doesn't know about this? If you're wanting the same thing, this video will be just what you're looking for. Hi, this is Dr. Hobbs, restoring hope and health for lifetime family wellness. So let's start with the second question first. Why doesn't my doctor know about this? Well, there are two answers. The most significant answer is that almost all doctors are experts in disease management, not wellness care. That means they look for diseases to diagnose and are experts at treating them with well-researched drugs and surgery. Think of most medical clinics as emergency rooms that had babies, and the world-renowned places like Stanford, UCLA, and Sansom as emergency rooms on steroids. They're almost entirely about diagnosing and managing disease. Right, so the second answer is that these applications are cutting edge, pun intended, even though this laser I'm talking about is non-thermal, so it couldn't cut if it tried. So now I'll run through some of the research highlights for each of the most common conditions that we treat. I'll tell you the conditions and the basic findings of a research study or two. Then in the description, I'll give the study title and hyperlink. In later videos, I'll discuss the treatment and results more and how we apply that to patients in our office. So even the summaries are too much for a short video for all these conditions, so I'll get started in this one and finish up in the next video. All right, sprains and strains, ankle, shoulder, neck, back, tendonitis, bursitis, golfers, tennis elbow. This also applies to reducing pain of muscles, joints, etc. So one reference showed they did a 904 nanometer and a 632 nanometer laser, which is what we have, showed they're effective at reducing tennis elbow pain, and the research published combining 5 separate placebo-controlled studies. Another one led the FDA to determine that lasers in this particular device that we use are effective in treating any musculoskeletal pain condition from toes to nose. All right, when compared to opioids, NSAID medications, and other light therapy. All right, so references are below. So next, take a look at these research results from one of these studies that we just talked about that tracked patients for 12 months. The first one shows pain reduction compared to placebo at 3 weeks, then 2 months, after the treatment was stopped even. Of course, the placebo group worsened. And here, this graph shows pain ratings at 3 week and 12 months follow-up. The laser treatment group just kept getting better. Now that won't happen with everyone or every type of condition, but it shows how it promotes and kickstarts the natural healing process. All right, next, sports and auto accident recovery. This included wounds and injuries to the ankle, knee, Achilles tendon, elbow, shoulder, wrist, and finger joints. The study using low-level laser improved healing time by 25 to 35%. Think of that. Your kid sprains his ankle or breaks a bone. Instead of being out of his athletic event for 3 months, it could be 2 months. Or you get into an auto accident and the pain and disability may not become a chronic problem, but goes away like it should. Right? You can see the references below. Now, I won't take time to cover the placebo-controlled research now, but I'll give the links below in pretty impressive studies on chronic neck, shoulder, and back pain improvements. All right, the next one is plantar fasciitis. Plantar fasciitis is one of our favorites to get rid of, partly because it's so resistant to improvement otherwise. So it usually takes months to get better, if it does. All while you limp around and your chiropractor keeps needing to adjust your spine, which that limp keeps throwing out of place. All right? Plantar fasciitis is pain in the heel caused by tearing of the fascia or inflammation of the nerves. In one study, non-thermal laser treatment for people who had plantar fasciitis for an average of 12 months resulted in pain going from 7 out of 10 to 4 out of 10 after treatment 2 times a week for 3 weeks only. The placebo group, which used LED, improved from 6.5 out of 10 to 6. It was barely a change. Wow, okay, that's a lot of information. Yeah, I'm pretty excited about the new technology we have. We're able to help our existing patients recover more quickly and more completely. And we're able to help with conditions that we previously couldn't help at all. So if you're interested in brain or sports performance, or peripheral neuropathy, you'll want to see the next video. In the next video, I'll focus on summarizing our efforts we have seen or that research has demonstrated with laser treatment for concussion, strokes, nerve damage repair, peripheral neuropathy, and enhancement effects of laser on sports and muscle performance and brain performance. And I may touch on its effects on fat loss too. All right, so that's it for today. Have a wonderful day, and you can text the keyword laser to our office phone number if you want a month-long video series on healing effects of laser sent straight to your phone or device. Otherwise, if you want to give us a call, we'd love to help you out. We are accepting new patients, and or you can go to our website and learn more there. All right, have a great day. May God bless you.